We are now just over a fortnight away from July the 19th, the day on which the government still seemed determined to remove most remaining COVID restrictions in England. With 85% of adults having been given one dose of a vaccine and nearly two-thirds having received both doses, the link between case numbers and hospitalisation appears to have been broken. Or has it? Well, the paediatrician Adam Finn is a member of the Joint Committee on Vaccination and Immunisation, which advises the government on its vaccines policy. He joins us from Coimbra in Portugal. Dr Finn, are we on track for the end of lockdown, do you think?
It's a really difficult question to answer, to be quite honest. The rate of rise of cases is very substantial at the moment. Of course, there is very clear evidence that the vaccination programme has massively reduced the number of hospitalisations and deaths, but they are nevertheless going up right across the country. And that, I guess, is the critical factor that determines whether or not things can normalise. So, yes, who knows? I guess we are in a very unusual, unprecedented situation, and it's very tricky to give you a straight answer.
Well, we heard from Robert Jenrick, the Housing Secretary, a little earlier, some noises that seem to suggest that we're heading in that direction. But are you sympathetic to the BMA's case that even if we do open up, there should be some restrictions, for example, the maintenance of mask discipline and so on?
Well, on a personal level, I shall certainly be continuing to wear a mask if I've got any symptoms or if I'm in an enclosed space with lots of other people for a prolonged period of time, indefinitely, in fact, because I've learned that by doing that, I can reduce the risk of transmission of all sorts of...
Indefinitely?
Yeah, absolutely. I think we learned, as paediatricians, we learned that we can avoid massive problems with children getting sick in the winter by doing these kind of measures. We simply didn't see the epidemics of respiratory viruses last winter that we've seen every year throughout my career. So I actually now completely understand it, whereas I was puzzled before when I saw Asian people in the tube wearing masks in the pre-pandemic era. So I think mask wearing is obviously something we've learned is extremely valuable to do under certain circumstances. That doesn't mean I'll wear a mask all the time, but it does mean I will some of the time.
Well, if we're thinking about return to normality, some of your scientific colleagues worry that daily publication of data on deaths and infections and hospitalisations and so forth are essentially panicking people rather than reassuring them. Do you think it's time to stop the publication of that data, at least with that frequency?
Well, I actually think that it's important to share information with people. I think the moment you stop doing that, you run the risk of people not trusting you anymore to explain the actions that you're taking. So certainly in the area where I'm involved in advising the government, which is around vaccination, we're very transparent with the data and the evidence that we use to drive those recommendations. Of course, I think when you provide information, you need to explain it. It doesn't really make any sense to just give numbers without explaining what the implications are. But I'm not really in favour of suppressing information, no.
The Health Secretary this morning is saying that we need to learn to accept COVID and treat it essentially as the same as flu. Well, each year, according to the ONS, we see something like 22,000 deaths from flu. Do you accept that actually that is what we're going to have to live with now? It's inevitable.
It looks very likely that this coronavirus, like the others before it, will be with us for the long term. I think in the short term, exactly what it does and how much trouble it causes around the world looks pretty daunting. In the longer term, I think it remains with us. And just how benign it becomes over time is a matter of speculation. But yes, I don't think we're going to see this virus disappear. I think it's going to join all the others that cause trouble for us every year. And we are going to have to learn to live with it in the longer term, yes.
So more excess deaths. Would I know you can't preempt JCVI decisions, but do you expect, therefore, for people to receive a booster vaccination to add to the regular flu vaccination each year?
Well, certainly we've made recommendations in the last week to if you like, provide us a sense of direction as to how a program like that would look and who would be targeted for boosters if it proves necessary. I don't think it's absolutely 100% sure that we need to do that, but I think we need to be prepared for the possibility, particularly if we begin to see signs of waning vaccine protection or escape from the protection that we've got from the vaccines as the virus evolves. So we need to be ready to do a booster program if we need to.
So you are worried about a fourth wave or not worried about a fourth wave?
Okay, you mean one after this one? I think I'm most worried really about the global situation. There are obviously countries where they're in fourth and fifth waves now. And I'm worried about that, not just out of a sense of fairness for the people around the world, but actually also for us in the UK. We've had this experience in the last 2 months of importation of a much more infectious virus from India. That will happen again if the pandemic goes forward unchecked around the world, and we'll be left in a worse problem. And I think that's the most likely scenario to cause a fourth or fifth wave in this country that would be out of control.
Adam Finn, thank you very much indeed.